everyone. Welcome to the Healthy, Wealthy, and Smart Podcast YouTube channel. I am your host, Dr. Karen Litzy, physical therapist and owner of Karen Litzy Physical Therapy, located in the heart of Manhattan in New York City. So before we go on, make sure you hit the subscribe button, hit the notification bell so you never miss an episode. Today, we are talking about something I have never talked about on the podcast, which I find really hard to believe. But today we're talking about TMJ. So, what is TMJ? How do you treat it? How do you evaluate it? What do you do if you have TMJ? So, to help guide us through that, I have Dr. Michael Gorman. He graduated from the University of Missouri-Columbia in 1993 with a bachelor's degree in physical therapy. His clinical career is focused on orthopedic manual physical therapy. His postgraduate orthopedic manual physical therapy training includes 5 years of residency, fellowship, and PhD training, all through the Ola Grimsby Institute. As his career evolved, he really developed a passion for TMJ, which is why we're talking about that today. Dr. Gorman previously owned a private practice PT company in St. Louis, Missouri, before selling to a national rehab provider in 2017. And in 2020, he started iMove PT, a mobile physical therapy practice, which he has since franchised with a couple of franchises in the Midwest. His goal is to give PTs with an entrepreneurial spirit the ability to have their own business with the support of a proven PT mobile brand. So I really thank Dr. Gorman for coming on the podcast, talking about TMJ, because it is something that affects so many people. And it's really important if you are suffering from TMJ, go to your dentist, go to your doctor, get a referral to a physical therapist who specializes in the treatment of TMJ, because it can make a huge difference, as you'll hear in this podcast today. We go through, or Dr. Gorman, I should say, takes us through the steps of how he evaluates and how he treats and the questions he asks and what to look out for. It's a really informative podcast, so I'm really grateful to have him on, and for my first podcast about TMJ, which is kind of crazy. So everyone, enjoy today's episode, and if you have any comments or questions, leave them below in the comment section, and we will get back to you. Have a good one. Hey, Michael, welcome to the podcast. I'm happy to have you on, and I'm excited to talk about issues surrounding TMJ, because I don't think I've had that on the podcast yet. So this is the first one. I'm so excited. So thanks for coming on.
Well, thank you very much for having me. I'm truly honored to be here. I'm a longtime fan of yours. I admire the work you've done. So thank you for having me on today.
Pleasure. So before we get into what is TMJ and how can physical therapists help, can you give the listeners a little bit more information on your journey into this subspecialty of working with people with TMJ dysfunction?
Sure, absolutely. So I have been a physical therapist since 1993. So as we're sitting now, I'm coming up on 30 years.
Congratulations.
Thank you. Thank you. I think when I was first getting out of school and I heard someone was out for 30 years, I'm like, oh my gosh, aren't you retired yet? Not quite. So it's, my career always has been heavy on orthopedic. I'm a fellowship trained manual therapist. But even through all that, I never really treated much TMJ until, sometimes we are not forced into something, but something comes up where you don't have a choice and you have to choose to do something that nobody else is doing. And so that's really what happened. I used to have an outpatient company here in St. Louis, Missouri. And at that point in time, we only had 2 clinics, and we had just built out or just moved into a brand new big office because we were growing. And sure enough, Karen, as you know, when that happens, something always happens after that. And there was 2 outpatient physical therapy clinics that opened up within a mile of me about 6 months after I built out this huge office with big rent. So a lot of our referrals that were always coming to us, all of a sudden, the referrals began to slow down. And so I was starting to think to myself, well, what can we do from a practice standpoint that can help a lot of people, that there's not really any therapists in the area that's doing it. And so I started to think about, what if we launched a TMJ program? Because at least in St. Louis at that time, and still is, you have to search pretty hard for a PT who treats it, enjoys treating it. And so that
Mm-hmm.
was like 2007, 2008. And I found out a couple things. All those patients I used to ignore when they talked about their TMJ, you'd ask them about their neck pain, and they would say, "Oh yeah, I have this here," and I would just pretend like I didn't hear them almost. Those people need help, and we are absolutely the right kind of people to help them. And then the other thing is I found that when you go out and market to a dentist office, they are such incredibly nice people. And so it became pretty easy to grow this program. And when you treat TMJ, you treat cervical. When you treat cervical, you should
Mm-hmm.
be looking at TMJ. So it was a real natural fit, and that was 2008. So for the last 15 years, I've treated it. I'm happy to treat it, and we can help so many patients out there if we just get over our, I don't know if it's fear of lack of training, or feeling like it's really not our field to work on that, but it absolutely is.
Yeah, and that leads into the next question is what is the role of the physical therapist in the treatment of TMJ problems? Because I think for a lot of people listening who maybe aren't in the medical field, they're probably thinking, why would I go to a physical therapist? Don't you just go to your dentist and get a bite guard or a
Right.
night guard and then you call it a day? So,
Right.
what is the role of physical therapy in this diagnosis?
When we look at the TMJ, so TMJ is temporal mandibular joint. It's where your jaw meets up with your skull. And it's just a joint like any other joint in the body. It's similar to a shoulder, and that you have a joint and you've got a joint capsule, and there's a little disc in there, and there's ligaments, and there's muscle, and all those things. And so um, the role of the physical therapist in treating TMJ pain is just like the role of the physical therapist in treating neck pain or shoulder pain. And it's just we have to create awareness. We most people, when they get TMJ pain, they either ignore it, they get a bite guard made for it, they
Mm-hmm.
get their a tooth ground down, they
Oof.
ignore it some more, they take drugs for it, and then it's just a cycle, and they get caught in the cycle. So our role is, I feel we have such a huge role in the musculoskeletal world of treating TMJ pain, because you can, because I've marketed so much in the last several years. And when you go into a dentist office, most of them are so happy to see a PT that likes treating it, because they don't
Mm-hmm.
want to treat it, or they don't, besides a night guard or splint or something like that, they don't really have those tools in their bag. And so they're so happy when I come in, because their patients now have an option. So I hope that answers your question.
Yeah, I think it does. And now let's go right into the evaluation of a person who comes to you with TMJ pain. So let's talk about the subjective first, because now you may have someone come off the street through direct access who is somehow enlightened and knows that physical therapists can treat this, or maybe they're coming from their dentist with a prescription. But what are some of your sort of must ask questions to people with TMJ pain?
Yeah. Great question. And I would say I follow really the same subjective that I do for almost everything. I want to know, how did this start? How long have they been dealing with this constant chronic pain? Because look, if someone's having a pain for a day or two, or a click or pop here, those aren't the people that are going to wind up at our door. Those are not the
Mm-hmm.
people that are going to pay cash to come and see you, or to come and see me. So it's the people that have struggled with this for a long time. I mean, I want to know what makes it worse. I want to know what helps. What treatments have they had in the past? And I want to talk about their occupation. I want to know about, like, who is that who is that pilot in that cockpit? Who is that pilot in that cockpit? I want to know everything about them, their job. I want to talk about, are they on the computer a lot? And how does stress impact this? Because there's a couple things I've seen about TMJ patients. And one, predominantly it's age 20 to 40, predominantly female.
Interesting.
Very, I can count on one hand, and judging by the amount of gray hair I have, I've been doing this for a long time. But the number of male TMJ patients I've had, um, and there's almost always a stressor component, and there's almost always a cervical component. There's a cervical component that may not be driving this, but is keeping this active. I would say so.
Mm-hmm.
But just really spending time with that patient, because when you're treating someone's TMJ, and that's a very intimate treatment, because you're right there, and you have to
Mm-hmm.
stare at them, and as they're opening and closing their mouth, you're like whatever, like 12 inches from them, and you're staring at them, and it can get a little bit uncomfortable. So you just got to really put them at ease. I
Mm-hmm.
think that's the biggest thing, and know that you are there. You want them to know that you're very empathetic, just like we are with every patient. But these people, when they come to you, they've struggled for a while.
Yeah, yeah, they may not be in the best place. So
Yep.
really building trust and empathy right away sounds like it's really important. And like you said, the intimate nature of the evaluation and the treatment, which we'll get to,
Mm-hmm.
um, I think you have to build that therapeutic relationship early on. So aside from the subjective, what are you looking at from an objective standpoint? What are some common objective signs that you may see as a physical therapist in someone with TMJ dysfunction?
Yep. Well, first, it's seems so basic, but we have to look at posture. Posture is such a huge. I've treated very few TMJ patients that have great posture. Just like
As I sit up a little higher
I
here.
saw you. I saw you, Karen. I saw you sit up. Um, but it's true, because the thing is, when you have a forward head, like 95% of our patients do, um, what happens is the mandible actually retracts. So
Mm,
as the head goes forward, the mandible goes posterior. So the mandible can jam that articular fat pad that's sitting back in that joint, which can be very, very painful. So that's first and foremost. I'm looking at standing posture. I'm looking at sitting posture, and I tell them, I put them in a chair. Okay, just relax. And how do you normally sit?
mhm,
How do you normally sit? Because I want to see what normal is for you. Um, and then after that, I do look at cervical range of motion. Think that's super important. Little tip I can give you is that in your audience is, when you're doing cervical active range of motion, have that patient sitting.
mhm,
Whether it's sitting in a chair, sitting on a plinth, a table, um, because it's never happened to me, but I've heard stories about this, where you're doing a cervical extension, and then, especially if there's an upper cervical instability that you haven't obviously picked up yet, um, they could black out, they could fall down. It's a lot easier if they're sitting. So anyway, I do that. And then I start looking at TMJ. I look at facial expressions. I have them smile. I have them kind of chomp their teeth up and down, just to look at bite. I'm not a dentist by any means, so I don't claim to be the expert of that, but I want to just see what that looks like. Are they missing teeth? Are they, I look, one thing that's really interesting is, next time you have a TMJ patient, because I know after this podcast, you're going to go searching for those TMJ patients, uh, is that you'll look at their face, and you'll see atrophy on the side that they've had pain. You'll see it. It's pretty striking, honestly. Just like anything else, if you don't um, use something, or if you have pain and forcing you to not use something,
mhm.
you're going to have atrophy in the area. And
And
then from there, you look at strength testing. I do look at, mandibular strength, right and left. If they have atrophy on the right side, they're probably not going to want to laterally deviate to the left too well. And I do palpation. I do extra oral. I do cervical, and then I put gloves on, and I do intraoral. And that's super important. I don't think you can treat a TMJ effectively unless you're doing intraoral work.
and when you're evaluating all of these different facial expressions and range of motion or strength, which I'll get to in a second. But are you looking for asymmetries from side to side, or are you looking at what evokes their symptoms? What exactly would be that sort of red flag in your head of like, okay, this is
Yeah.
not normal?
Well, those are great things to bring up. So I mean, I don't really worry so much about a click or a pop unless
Okay.
it's painful. We
Okay.
all have clicks and pops in our jaw, but if it's painful, then that's obviously something. Ooh, I got to really take note of that. I'm looking at, just like for any other joint, right? We're looking at quantity. So when someone opens their mouth, we look at vertical opening. Are they able to get 40 millimeters of opening? And if so, how do they achieve that? Because the body works best if it's symmetrical. It's when
Mm-hmm.
it's asymmetrical that things go awry. And so, when they open their mouth, do they have a C curve? Do they have an S curve? Do they have any proprioception at all to know? And most times the answer is no. But I'm always, I want to make sure the patient knows that they're in charge. I always tell them, just open your mouth as far as you can without pain, or with, where you feel it is fine, but no sharp pain. Don't go past your pain, things of that sort.
Mm-hmm.
But
Mm-hmm.
yes, absolutely. We're definitely looking at what's the quality? What's that mandible doing? Is it shifting all over the place? Is it just a big hypermobile mess?
Mm.
Maybe it's one side. If someone has an S curve, we tend to think of that as a very hypermobile individual. They just don't have that coordination in there. Whereas if it's a C curve, one side, we tend to look at that as that side, that it's going to be a hypomobile joint. That joint is not opening. So as the jaw is going, if it deviates to the right, it could very well be hypomobile on the right side.
Mm-hmm.
But just like everything else, there's no, like, not anything set in stone, but just some things that I've observed.
Right, right. Kind of keep an eye on all these things, knowing that like it depends,
Yep, of
right?
course, yeah.
And how are you assessing strength of the
So
mandible?
yeah, so with strength, what I do, it's so hard on a Zoom to show it. Question: does this go on YouTube?
Yeah.
Oh, good. Well, then I'll use my hands. But anyway, if I'm checking the strength, let's say for example, the right lateral pterygoid. So
Mm-hmm.
when the lateral pterygoids work together, they do protrude your jaw. But when one
Mm-hmm.
side works independently, it laterally deviates to the left. So if I'm checking the strength of the right lateral pterygoid, I'll cup my hand around the left mandible, and I'll have the patient push into my hand, and I'll gauge what that contraction is like
Mm-hmm.
compared to the other side. And if the patient's had pain, if the pain's on the right side, pretty much guarantee that when they try to laterally deviate to the left, there's not going to be much force there.
Mm-hmm. Mm-hmm.
And
Okay.
so that's, from a strength standpoint, I'm really looking at that
Got it.
probably more than anything else.
Yeah, that's great. Thank you. And yes,
Mhm.
this is up on YouTube. So for people listening, if you're wondering, well, wait, what's he doing? I can't see it. Go over to YouTube and you can see it. Little
I
shameless
I I
YouTube
think I
plug
think
there.
you had a guest. I forget who was a couple weeks ago, but she apparently, I think it was the therapist that was talking about the hip, and
Oh,
she
yeah.
did she have a hip model or
She
something like
did.
that?
She did. She did.
Yeah. Well,
Yeah,
sorry, I I,
Dr.
I couldn't
Grimaldi.
afford a
Yeah.
face model.
That's okay. That's okay. But no, that was good. It was good to kind of look at that visually and kind of what that looks like for the testing of strength. So that's great. So you get through an evaluation, you find, you look at your findings
Mhm.
and now you're on to treatment.
Mhm.
So, can you give a couple? Obviously, knowing it depends, and every treatment is individualized
Sure.
every time you're working with a PT. But are there common um, protocols? I don't know if that's the right term, but
I know.
treatments that I know
Right.
I hate saying protocols, right? That you employ for these TMJ patients.
Yeah. Well, I almost always, I'll start with manual therapy of some kind, whether it's like maybe some soft tissue work to the masseter, the masseter muscle. It's almost always guarded down.
Mm,
And here's a little tip, if you don't know where it is, stick your finger inside the patient's mouth, have them gently clench down, and you'll feel it pop in your fingertips.
Mm-hmm.
Just watch your finger that it's not in between their top and bottom teeth, please. And you'll be just fine with that. But I'll normally start there, and I'll
Mm-hmm.
also try to do, sometimes a lateral pterygoid is hard to get to. It's pretty deep in there, but I try to do some light strumming in that area.
Mm-hmm.
And I'll do, specifically with the TMJ, I will mobilize the joint. If it's a hypermobile joint, I'll still mobilize just some small range oscillations for some proprioception. If it's a hypomobile joint, we'll do a prolonged 10-second hold.
Mm-hmm.
Either maybe do a distraction or an anterior glide or something of that sort. And super important, I'll do manual therapy with a cervical as well. I've started back in January, took my first dry needling course, which I love. And so I won't learn dry needling to like TMJ until my third course, but I learned a lot of good cervical, upper trapezius techniques. And you'd be amazed at the amount of TMJ pain, headaches that is caused from trigger
Mm.
points in the upper trap. So do you needle, Karen?
I can't do that in New York.
Oh, you can't do it in New York?
Nope.
Doggone it. Well,
So
well,
it's kind of like a moot point here. I'm not
oh,
going
I'm
to go spend
so sorry to hear that.
not
Well,
going to go
anyway,
and
that's
spend the money on that if you can't do it. It
right.
doesn't make
I
any
agree.
sense.
I agree. No, but so that's been super effective. And then uh, when we look at things from an exercise standpoint, the biggest thing I can tell your audience is to have the patient do the exercises in front of a mirror, at least in the beginning,
Mm-hmm.
because even you and I who have some aware proprioception, if you ask me to do vertical opening or lateral deviation in front of a mirror or without a mirror, excuse me, I'd struggle
Yeah, really hard.
really hard. So use that mirror to just start working with active range of motion. I really try to emphasize to the patient, like if they're doing vertical opening, keep it symmetrical. I don't care
Mm-hmm.
how far you're going. When you start to deviate off to one side or the other, stop. Um, I'll teach them how to do some self mob at home as well. We'll do a lot of posture, a lot of workstation ergonomics
Mm-hmm.
as well. And we'll work on a lot of cervical stability exercise. I like doing a lot of pulley work. So, when we're talking about cervical spine, you have to use very lightweight. But there's a lot of good stability exercises, things like that, because most times these patients, um, the whole kind of upper posterior chain is going to be shut down from the pain they've been having for so long.
Mm-hmm. Mm-hmm.
Um, and and then of course, we'll add in some TMJ isometrics and things of that sort. And be creative. I mean, I always think about if I was a patient and I came in and you had me do the same 4 or 5 exercises every day, I would just quit.
Mm-hmm.
I would just quit. I mean, you got to make it fun. You got to make it challenging. Um, for example, if I'm having someone do like a lateral deviation, like a mandibular lateral deviation, maybe I'll start in sitting. But then if you're trying to laterally deviate to the left and it's too easy in sitting, then I'll have them lay on the right side and I'll put a mirror in front of them, or they can use their phone and for the mirror,
Mm-hmm.
and they can deviate their jaw up towards the ceiling,
So you're
just
going
just
like
just to get
against
some
gravity.
gravity
Yeah.
involved. Yeah, yeah.
Yeah.
And you can get people in all fours. I mean, so many things that you can do to really challenge them. I'll combine cervical pulley exercises. They're walking around, they've got the pulley strap on them, and they're doing TMJ exercises at the same time.
Mm-hmm.
Um, I just want to make sure that the patient has success. You got as you got to dose the exercise appropriately. And I'm not a fan of giving a patient too many things at home.
No, because then they don't do any of it.
I know.
If you give them too much, you don't do any. I found like 3, 4 exercises seems to be a nice sweet spot.
I
You
agree.
know,
And
one or
I
two
try
too
to give
little,
them,
more than that, it's like a
yeah.
disaster.
And I try to give them more. Like I might on their home exercise program, they may have 7 or 8 things, but I always tell them just do 2 or 3 at a time.
Yep.
Because even if you're dealing with someone who's not working still, I mean, we all have busy lives and,
Mm-hmm.
or I might have them do one or two things 4 or 5 times a day. Sometimes it's more important, especially when someone's acute, to do the exercise more often for the proprioception, coordination,
Mm-hmm.
vascularity. So I might have them just do that, but I don't know. Just I think the big thing is I try to take as holistic of approach as I can. We do have to talk about diet and what kind of foods are you eating and what's bothering you. And to me, that can be easily turn that into a long-term goal.
Mm-hmm.
And that's something that you can easily track. You can be talking with that patient. Okay, when you first came in, you couldn't eat French bread, and now how's that going?
Right,
Um,
right. Almost as like part of your goal setting.
yeah, yeah, and but it's just I don't the amount of people that we can help is unbelievable. And the other thing is, like I said earlier, from a marketing standpoint, it's a nice it can be, if you do it right, a very nice line of referrals for you. I mean, I'm not saying I want to treat TMJ all day every day, but and those patients are so grateful. Well, just like I
Yeah.
think every patient is that has chronic pain, but TMJ patients are so grateful because mouth pain is the worst.
Yeah. And I think oftentimes they don't even know that physical therapists can help, so that if they're going in, if they have a dentist that refers to a physical therapist, they didn't even know this kind of treatment exists. And then when you can help them, I'm sure they're super grateful. And that, you mentioned marketing. That was my next question: is how do you market this? Who are you only marketing to dentists? Are you marketing to the general public? How are you marketing this subspecialty?
Hmm. Well, so here in Missouri, believe it or not, we are we're slow to change. We well, every state has direct access, of course, some version of it, but
Mhm.
our state and Mississippi and Alabama have the three worst direct access laws. We're hoping in the next month, fingers crossed, that it gets through the finish
Mhm.
line in our state capital, and we will have direct access to them. But so because of that, we haven't done in the past. It'll change soon, but we haven't done tons of general public education. So for us, it's doing a lot of like lunch and learns with dental offices,
Mhm.
oral surgeons. Oral surgeons most don't want to touch TMJ.
Sure.
Um, they know they don't always get the best outcomes with it. And actually, somebody else, another type of dentist that I think is, uh, I know I've kind of overlooked and is a periodontist because a periodontist is, and I know because I just had some periodontal surgery not too long ago. Not only are you having to keep your mouth open for a prolonged period of time, which can be very hard
Mhm.
on the TMJ, but you have to turn your head so much to get, they'll say, okay, turn your head to the right and left. And so when my mouth was numb, I was talking to my periodontist. I said, do you, you know, what do you do with people that have neck pain? She goes, it's a problem. So I'm like,
Yeah.
okay, well, guess what? We're gonna when my mouth is not numb anymore, I'm gonna come back here and we're gonna talk about what a physical therapist can do, not only for your TMJ patients, but for your cervical patients. And you need to know if they have cervical pain before they ever sit down in your chair.
Mhm.
Because if she's trying to do surgery for 2 hours on a patient and they can't turn their head right or left without
Right.
pain, it's going to be a bad
Yeah.
outcome. So yeah, it's
Oh,
just I
yeah.
think you just be creative. I mean, we've talked about TMJ with primary care physicians as well.
Mhm.
Um, I think it's truly I don't want to say an easy sell. There's nothing easy out there, but you for sure get people's attention when you go into an office. Say we treat TMJ now.
Mhm.
Everyone should know that if it's a Medicare patient, a dentist cannot sign off on a plan of care.
Oh, okay. Oh, that's
So,
interesting.
yeah. So when that has come up in the past, what we do is we get the patient's primary care physician involved.
Mm-hmm.
We'll either call the primary care physician or we'll just have the patient call,
Mm-hmm.
and they'll have to sign off on the plan of care because a dentist is not allowed to. So
Oh,
just have
okay.
to be
So,
very, very aware of that.
right, right. Well, as you said earlier, they're not probably your primary demographic, but
Absolutely.
it's still good to know that. Any other legal things that a physical therapist needs to be aware of? I
Um,
mean, I like any different waiver. I mean, it's a joint is a joint is a joint, right? But are there
yeah,
anything that, you know, you have to even tell the patient? I mean, I'm assuming, you want to get consent to work
yeah,
intraorally, to work inside the mouth,
yeah.
and there may be patients, I don't know, have you ever had someone be like, "No, I don't want you to do that?"
Uh, no, actually, I haven't because I think by the time they finally wind up in our
They'll
office,
do
they're happy.
anything. Yeah.
Yeah,
Yeah, yeah.
because they've probably been ignored for a while, or they've kind of been shunned, or they've been given drugs to
Right.
take, and they're still having problem. One thing for sure is make sure, guys, you wear latex-free gloves.
Mhm.
You know,
Smart.
and the other thing I would really say is that I've worked in a variety of settings in the past. And now in St. Louis, we have a mobile practice, and that is beautiful for TMJ or any practice you have where you can work one-on-one is beautiful because if you're treating a TMJ, then you have to hop out to work on someone's foot and then you're back to treat TMJ. It doesn't quite work. And especially if you're doing palpation inside someone's mouth, they feel if you're rushed, they feel it. And this
Mhm.
patient, maybe more than any kind of patient, they have to be able to relax. And when you have your fingers inside their mouth, that can be challenged. So
Sure.
really, um, I think it'd be very hard to treat TMJ if you're in a busy outpatient ortho clinic.
Yeah.
I,
Yeah.
I I think it's not like treating whatever, a knee or a shoulder because these people there's normally more involved. And if you do it right, you're treating cervical, upper thoracic, because if they have a forward head, that means they don't extend very well through their upper thoracic spine. That's all,
Mhm.
kyphotic. So you got a lot to really work on.
Yeah. Yeah. Well, great tips and great advice. So thank you for all of that. And now, as we wrap things up, what are the key points that you really want the listeners to take away when it comes to evaluation and treatment of TMJ patients?
Yeah. Well, I would say first and foremost, know that TMJ is definitely within our scope. And even you can't use the excuse of, well, we only had 1 2 hour course back in school. So I don't really know how to treat it. You can't use that excuse because our patients are coming to you because we are the experts. We are the
Hmm.
musculoskeletal experts. So please get good at it. If you need help, call me. I'm more than happy to help people. Um, so I think that's super important. You got to slow your mind and your body and your hands down when you are treating TMJ. Make sure you're looking closely at posture. Make sure you're really addressing cervical and upper thoracic spine. And then just really be creative with your exercises. I typically will see a TMJ patient. It depends, but 6 to 8 visits is kind of about right,
Yeah.
depending on maybe how much cervical and spine involvement they have.
Hmm.
But I think that's pretty fair. Most times the appointments are a little bit shorter, just depending on how much involvement um there is. And I think these people are going to be grateful. And I tell my staff here, and I tell every therapist that you may have patients that are like raving fans of yours, but you got to prompt them.
Hmm.
I always say, you know what? If you've had a good experience here, go back and tell Dr. So and so, and be sure to tell your friends because most fans, if you've done a good job and put forth a good effort, they are going to be raving. Our fans You want them to be raving fans to just really spread the gospel about what we do. Because as you said earlier, I think a lot of people, I still think a lot of the people in the world think that a physical therapist treats knees and shoulders and that a chiropractor treats the spine.
True. Yeah. Yeah.
So,
I would agree with that, which is obviously not true. Um,
right,
but I would
right.
tend to agree with that. Yeah. No, I think that's great advice for anyone who is interested in working with people with TMJ dysfunction. Do you recommend any courses or um, any extra continuing education?
I think that I'll be real honest with you. I think I'm going to do a TMJ course myself. I did one for my staff here in St. Louis, and it just went over so well. And I would be honest, I haven't looked. I know there's some online courses,
Mm-hmm.
but as far as in person, I don't know who's doing it.
Okay.
I did all of my manual therapy training through the Ola Grimsby Institute.
Mm-hmm.
So we definitely had some good TMJ classes through there, but I don't know what people are doing anymore. And it's so I think you gave me a good idea, Karen.
I didn't know you did one for your staff. That wasn't like getting you to be like, "Oh, that wasn't a sales pitch, I swear. I was just curious." But yeah, when you do, let us know and we'll put it out there if and when you do.
I will.
Um well, this was great. Before we wrap things up, last questions when I ask everyone is knowing where you are now in your life and career, what advice would you give to your 20-year-old self?
My 20-year-old self. Well, I would say to accept people for who they are.
Mm.
I opened my first clinic when I was 32, and I went through a lot of staffing changes because unfortunately I expected everyone I brought on as an employee to be an owner. And everyone has their role and everyone can be a great person, but that doesn't mean they want to be the owner. They don't want to work as much as the owner. And you just need to, I don't know, you just need to have fun and accept that and know. And I think that whoever, if anyone else out there is self-employed, don't try to change your staff PT. You want them to work hard, you want them to be caring, you want them to follow the rules, of course, but they're not you and they aren't the owner. If they wanted to be the owner, they wouldn't be working for you. So I think if I would really thought about that earlier on, it would have led to less staffing changes earlier on. I have a very stable staff now, so I think I've grown past that. But that's what I would say. Just accept people for who they are, because you know what, most people don't change.
Uh, 100%. That is great advice. And advice that takes a lot of introspection on our part. But I think that's beautiful advice. Now, where can people find you if they have questions, comments, they want to learn more? Where are you at?
I would say probably just email me. It's Mike at iMovePhysicalTherapy.com. You can go to our website, which is iMovePhysicalTherapy.com. We have a Facebook page. My kids would make fun of me, but iMove PT has an Instagram page. I probably do, but not very active on it. So I need to get better with that. But yeah, just and they can always text me 636-578-3649. That's probably the quickest way. And if you have TMJ questions, yeah, I mean, just wanna help people, and I will get a course out there soon, and I'll throw it your way.
Excellent. Thank you so much. This was great. Like I said, first time I think that on the podcast that we've discussed TMJ. Really great advice, really great actionable steps for anyone who's physical therapist listening to this, or if you're someone living with TMJ pain, now you know you can go to a physical therapist. So thank you so much for coming on.
You're very welcome. And Karen, I said it earlier, I mean it. Keep doing everything you're doing, because I know it's not easy to have a podcast that you put episodes out all the time, but you do a tremendous job of educating people on what what we do as a physical therapist. So thank you.
Oh, thank you very much. And everyone, thank you for listening and tuning in. And don't forget, if you want to see what we did today, go over to the YouTube channel as well. And everything is in the show notes on whatever platform you're listening on. So thanks so much. Have a great couple of days and stay healthy, wealthy, and smart.